very important for me, and perhaps for you, is changing a mindset about obesity. I confess, my thought was, the obese are the problem. That's a little bit like blaming the victim. That's not to say that there isn't personal responsibility. That's not to say that the individual doesn't have a role in addressing their own health and well-being. But if you look at obesity as an epidemic, and if you really focus on obesity as physical inactivity and poor nutrition, and if you're willing for a moment to focus on policy, systems, and environment, our focus should really be on inactivity and poor nutrition. Let's support the independent initiative and will of the individual, but let's address those factors in that person's environment that they have to struggle against to exert their will. So I'm suggesting a change in focus from, well, tell those people to get active and to eat better, and let's find a way to address the policy and the environmental issues that make it so difficult, that are so forceful in that person's life. Pioneering Healthier Communities, I hope, as you see, the YMCA is a part, it's a convener, but in order to be successful, and we've seen this in communities across the country, the depth and the breadth of the community leadership that come together is really the key to success for what we've seen in other communities that have a head start on us, so to speak. So who's our team in Evanston thus far? This isn't the end-all list. This is the list of those people that we've had a chance to have conversation with. Some have gone to Washington, some couldn't. Take 3 days in July to do that. So we're continuing to build our team, and delighted with the group that we have. The group that was around the table a couple of weeks ago had phenomenal energy. And I think it's energy more than rah-rah. I think it's energy inspired by more than a breakfast with Bill. I think there's real energy to the commitment to the long term that Matt Johnson was talking about, that we're going to have to commit to in order to move the needle. Our focus, as Tim suggested, is in childhood obesity 0 to 5. You saw none of the data on the slides. It started at age 5, boys, age 5, girls. We have a significant task here. That data is not readily available. There are birth certificates, and then there are entry of school records, typically. So we're trying to create data in the middle, in between birth and when they have to go to school and present their first physical information. So we have a huge challenge here. We've debated whether or not that's something we can even address, but we're going to give it a shot. We're going to see if we can, through the support of Martha Arnson, through the support of the home-based child care providers, through the support of the center-based child care providers, put together some data. There's some very interesting information out on the table, if you didn't pick it up, about early childhood interventions. I thought, well, how do you get a 1-year-old to be more active? It's been that long. My 4 children would tell you I don't have a clue about early childhood education, or education at all, or kids at all. But there's some very interesting information out there that talks about some very simple interventions with 0 to 5-year-olds that can help in the effort against childhood obesity. So our next steps. Tim and Ivana Thomas and others are working very hard to collect some initial data in this Community Healthy Living Index. It is not a YMCA concoction. It is a very robust, widely accepted measure to establish community health used across the country. We have, by the middle of December, to complete our initial community action plan, which will be around childhood obesity age 0 to 5. It's an initial first step, first phase, almost like pilot or beta site plan. Engage the community further and broader and arguably louder around this activity. And there's ways for you to get involved. Sandra Hill has offered to be our community coach, and that is the strongest of the links between this effort and the community to make sure we can convene this broad and deep group of community leaders. We have about 10 or 15 minutes, and I'd like to stop and would be happy to engage, have some question, have some conversation. Please don't just pick on me. I've got Tim as a target, me, Sandra, and Seth, and Reverend Dennis, and so what do you think?
So next steps, Bill, for this group, where do we go? Should Matt answer that, or I don't know?
If there is a real desire on your part to get involved, Sandra Hill and her contact information was up there. Please get in touch with her. Right now, what we're focused on is data collection. And Tim, I don't know if I can answer the question if there's anything this group can do right now to help in that data collection activity. We've got about 700 data points at this point, and I know we've got another week or so to go where we hope to expand that database.
Well, we always need the volunteers. Sandra's coordinating those volunteers with the people on the committee. We've already, as you said, gathered quite a bit of data, but to go into households and some of these sites, I think more volunteers would be helpful.
Great. So there's a need for volunteers to actually do these surveys, because they're one-on-one surveys. It's not focus group, or we don't get a bunch of 0 to 5-year-olds in a room and have them press buttons too. The other thing I would suggest is share this in your other groups. Share this in your workplace. Share this in your faith community. Share this in your book club. Share this with those people that you're visiting with at a cocktail party. To express your commitment, to listen to them and hear their stories, and to engage the community in this conversation. Mary Beth?
2 questions. Have you guys hooked up with the home visitors from Infant Welfare Society and District 65 Family Center?
Yes. Who
Who visit with the 0 to 3-year-olds? Okay, great.
Yes.
To do some of that data collection. And 2, have you pulled in any of the many people in Evanston who are working on growing healthy food, the Talking Farm and Sage, which is the school gardens, and all of that?
We have yet.
No.
Because there's such a strong movement of that, so Sage is all the school gardens, but they might be interested in working with preschools, you know what I mean? And the Talking Farm folks now actually are going to have a little land just over the border in Skokie, and they're really eager to do education, so maybe that's an avenue to go.
Yeah, I think that's a good idea. We haven't yet because we're busy collecting the data, but I definitely believe that as we get that information in, when we get that information in, then we can develop those objectives and then figure out how to expand our base. So, yeah.
One other thing I want to add to the community group, we've had several conversations with Northwestern. Northwestern has a comprehensive center on the study of obesity. I'm sure I didn't get that name right. But Dr. Shapiro has been very willing to talk with us about engaging a person from the Northwestern community to be part of this. I didn't want you to look at this and go, where's Northwestern? For those of you who don't know, Bill Stafford is at Northwestern, is at ETHS, and we've got District 65 represented here. Ted?
Oh, I'm just going to costing out this. You see the commercials, I forget which hamburger it is, where it just shows how much bigger it is. There must be, and then it shows a very economical price for that big hamburger. Is there a way to cost out to various income levels what it really means in terms of that hamburger? No, you think you're just paying $1.89, but if you start adding in healthcare costs, which result when you become, that becomes part of your regular diet, you're gonna spend much more than $1.89, or somebody's gonna spend much more than $1.89 for that hamburger. And I know that's sort of right to the gut fight, but I just wonder if that might have an impact. I don't know if, how you get around. There's people fighting various, we won't get into political names, but there's people fighting, things with soda, right? You see those commercials. Those are they come off as motherhood, God, and the flag. And if you're opposed to this, or if you're in favor of taxing this, there's something evil about you. And I just wonder how we might approach that.
I don't know. From a statewide level, I can tell you when a group of state communities in the state got together down in Springfield with the Director of Public Health, the YMCA being the convener but not the only voice at the table. They invited the Sugar Beverage Industry Council in Chicago, and they thought it was a trap. We can't win that. We can't win at this point, by fighting, perhaps. But that was a very powerful meeting where they first sat down and said, here's where we need to be talking. We need to be talking around the same table, not talking at different tables and lobbing at each other. But I don't have an answer for that. Gretchen?
Have you connected with the group, the CLOC group in the city of Chicago? CLOC stands for something like the Coalition to Lower Obesity in Children, CLOC. And it's a nice clearinghouse of both information and I would also say grants, money.
Yes.
And it's a group that I've gone to some of their meetings in connection with both District 65 and 202 wellness councils. There's a federal law that mandates schools have a wellness policy and a wellness council, and those policies need to address specific points related to physical education, nutrition, and the curriculum. And both of our districts obviously have this policy in place and are doing various things around this policy. CLOC is bigger than just that, and it's more along the lines of what you've been describing. And they're a terrific source of information and, as I said, money. So,
I'm only vaguely aware of them. I've heard. That would be great. We'd love to connect with them.
Yeah.
Kristen?
Oh, I just have a question, and I don't know if any of the owners of grocery stores in Evanston are actually community members, but I mean, even thinking, when we talk about diversity and shopping at Food for Less, and you can have a whole wall of colored sugar water, but try to find 100% juice, but if there's a...
They have 100% juice.
Yeah. Actually, they have very small...
I think you have a great question. Our work is currently being funded through the Sam's Club Foundation. The Sam's Club Foundation gave $1 million to the YMCA of the USA. The YMCA of the USA is distributing that to communities throughout the country. So Sam's is very interested in being involved. We're not yet connected with them.